Hi, my name is Jaime Schuette, and I'm a physical therapist of roughly 23 years now. I am a certified strength and conditioning specialist, a certified Ashtanga yoga instructor, and a certified pre-employment and return to work screener. My undergrad is in psychology, and I hold a master's and a doctorate in physical therapy. I have worked with pediatric to geriatric clientele. I've worked in all different settings, from skilled nursing facilities to inpatient rehab hospitals, outpatient centers, country clubs, you name it, I've done it. I have also worked with professional athletes at times as well. As far as my approach to physical therapy, for the most part, despite any imaging that may look like a train wreck, overall, I encourage my patients and tell them that they just need to move. I also explain to them that sometimes their pain symptoms are actually stemming from something that's coming in their life, as far as maybe a stressor is kind of adding to that, or they're dehydrated, or they haven't slept well, etc. I obviously encourage them to the fact that despite what that imaging looks like, again, oftentimes that's either normal for their age or for life processes that they've gone through, but that should not stop them and is not preventative in itself of them leading a absolutely normal life. So while I do have them feel heard and looking at it again, generally, quite honestly, I pretty much throw that to the side unless there's a major concern of a fracture or some kind of surgery that is involved and I need to be aware of a particular protocol. As for my approach in general too, I am also using, for the most part, just exercises. So again, I am promoting movement. I am giving them exercises that they need to do at home. I keep it simple for them so that they buy into it and that they will follow through with it. I may end up giving them some short videos just so that they feel like it's easy to follow along. I do some manual skills with my patients, so that may include some hands-on stretching, or it may include myofascial release, contract, relax, etc. I am a firm believer more so in dynamic stretching. So if I am really doing that too for a patient, then I'm going to promote that for them and show them how they can create better transfer to their life activities and perhaps sports, for instance. I rarely use modalities. And again, at the end of the day, as far as my evaluation is concerned, I'll overall look at their posture. I'm a huge proponent on educating them as I'm looking at them. I'm letting them know how perhaps, that they can sleep better. So maybe, again, they make a change as to something that they're doing there, or something that they can do as far as their sitting posture, their daily activities, if they have a job, etc. And then I'm looking at their gait mechanics, as well as their overall range of motion, overall strength, and their ability to perform functional activities. I am not huge on using manual muscle testing because I think, again, at the end of the day, somebody can test out as strong or weak, and they can present as somebody that can move just fine. So again, I tend to look more at functional mobility overall and how well that person's moving, again, to kind of make a determination as to where I need to go. And also, I will usually look bilaterally in comparison. So if there is a huge outlier on one side, that's kind of a little bit of a way that I would manage that patient. But overall, again, just really educating them that oftentimes pain really is something that can often be something that you're just made aware of, but not a stopper in your ability to continue to function. I have definitely had the patients who have come to me and said, my doctor told me that I'm never going to move my knee any more than it is now, or I, will never return to running, etc. And while I basically let them know that I'm hearing them, and perhaps don't let your doctor know that I don't necessarily agree with that, but again, I allow them through movement to really basically just see that, hey, they were actually able to make a difference and to kind of prove that doctor wrong. So that's a little bit about myself. And if you have any further questions, then please reach out to me, or you can visit my website to learn a little bit more about me. That's www.fitnessontap.net. Thank you so much.